Hi, I'm myself from SNS College of Physiotherapy. Today we can discuss with my mentees about ulnar bone and radius bone.
Hi, I'm Safia from first year BPT. Today we are going to talk about radius bone. Radius is the lateral part of the forearm and it has homologous with tibia. It has three determination: upper, lower, and shaft. Upper is disc shaped. Lower has a tubercle. Shaft is sharpest. It is a right hand bone because it is radial tuberosity is medial part.
Hi, myself Samraj, first year of BPT. I am going to explain about radial bone. Radial bone contains three parts: upper end, shaft, lower end. Upper end contains head, neck, and radial tuberosity, which is present in medial side. And shaft, it contains three borders, three surface: anterior surface, posterior surface, lateral surface. Borders: anterior border, posterior border, and medial border. In our lower end, it contains three: Styloid Process, which present in lateral side; Distal tuberosity, which present in posterior; and Ulnar notch, which present in medial. Thank you.
Start.
Hi everyone, I am Sadasha, first year PPT. Today I am going to discuss about the features of the ulnar bone. Ulnar bone, it has three parts, which are upper end, shaft, and lower end. The upper end contains Olecranon Process, trochlear notch, radial notch, and ulnar tuberosity. The shaft has three surfaces and three borders. The surfaces are anterior surface, posterior surface, and medial surface. The borders which are anterior border, posterior border, and lateral border. The upper end has head of ulna and styloid process. The styloid process is present posteromedially to the head of the ulna.
Myself Sivaran from first year BPT, and I am going to talk about the clinical anatomy of the radius. Polys fracture. In this, the radius commonly gets fractured about 2 cm above its lower end, and it is called as polys fracture. The distal fragment gets displayed upwards and backwards and make the inner fork deformity. Mixed fracture. In this, the distal fragment gets displaced anteriorly. The reverse of polys fracture. Pulled elbow. In this, this occurs due to the sudden jerk on the child hand.
Hello everyone, I am Kirtisha from first year BPT and I am going to talk about myology of radius. Here is a muscle which is known as supinata, which is present below the radial neck, and the second muscle is biceps brachii, which is present between the radial tuberosity. The shaft contains flexor pollicis longus, and the lower end contains brachial radialis. And this is an ulnar bone. Here is a muscle which is known as brachialis between the coronoid process, and near the brachialis there is a supinatal muscle which is present anterior side of bone, and there is a shaft. Here it presents flexor digitorum longus. In head of the ulna, above the head of the ulna, there is a prenatal quadratus. Thank you.
Hello, I am Akacha, first year BPT. Today we see about the ulnar bone. Ulnar bone is the medial bone of the forearm, and it is homologous with the fibula bone. Fibula is nothing but which present in the leg. Side determination of the ulna. Ulna have upper end, shaft, and lower end. Upper end, which is like hook-like structure, and the shaft is a very sharp and breast-like structure. And it has placed in the left hand bone because the pointed styloid process lies in posterior.
Anatomy of ulnar bone. Right sticks fracture is the fractured shaft of the ulnar bone. It occurred due to the direct hit on shaft of the ulnar bone. Montagial fracture. It is the fracture on the upper 1/3 of the ulnar bone, and it occurs with the dislocation of the head of the radius. Hume's fracture. It is the fracture on the Olecranon with the anterior dislocation of head of the radius.
Most commonly, these both bones are undergoes fracture only. So treatment for the fracture, so mainly you undergoes PUP, that's the plaster of Paris. Next, and also in any displacement or any fracture, undergoes only to the open reduction surgery. Thank you. Main physiotherapy treatment for the lateral epicondylitis. So that patient treatment must undergoes at least 1 week, and the follow days the patient must must undergoes the muscle strengthening exercise also. Thank you.